very excited to be with you here this morning, and thank you so much for joining us bright and early this morning. This is a very important day for the province and for all of us in our commitment to continually improving the quality of the healthcare system in Ontario through the Ontario Cancer Plan and the Ontario Renal Plan. And today's theme is Together We Will. And that theme reflects the partnerships and the collaboration that will be required to build high quality and sustainable healthcare systems.
This is something that's quite personal to me. Obviously, 2005, the first Ontario Cancer Plan was published, and to see the progress now with OCP 4 or Ontario Renal Plan 2, first thing to say is obviously congratulations to Michael and Garth and Joanne, their teams, for actually putting this together and continuing what is really leading practice in the Ontario health system. So I'm extremely excited.
No surprise, the goals and strategic objectives in each of these system plans share common areas of focus, including person-centered care, integrated care, and improved patient access, to name just a few examples. But while there were similar foci between these two plans, each one is distinct as they address patients with very specific needs. And the cancer and kidney care systems are really at quite different stages of maturity, and so there are specific opportunities for improvements in each plan that reflect this. So I'm very excited about the potential of these two system plans and what they will mean for all of us.
The OCP is OCP4 has been built on the foundation of the first three cancer plans, and we certainly want to reflect on what we've been good at in the past for driving accountability and quality, and part of that is moving with us into a stronger partnership model. The patients want more of a voice in how care is delivered. And what does that mean? What does it mean to partner with patients and families? For us, it means partnering in a true sense. This is not about filling them in, letting them know how it's going, keeping them updated. This is not about just sending out a survey. This is not about mounting a suggestion box on the wall. I think we were groundbreaking in having our patients roll up the sleeves with us right from the start, helping us to prioritize the goals, prioritize the strategic objectives, and help us with the language from beginning to end right through the plan. We also had many patients share their very personal stories with us, and we've embedded those stories into the plan to remind us that there is a real impact of cancer, and we can't stop forgetting that.
This is the first time, being our second plan, it's not, there's a lot of firsts, but this is the first time that we significantly involve patients and families in the development of our strategies. So we consulted and we listened. When you do a provincial consultation, you get good stuff and also things that you didn't really want to hear. But what we did hear were two, I think, important themes. One was, yeah, you're new. We like what you've done so far. We like the way you're going. A couple of your indicators could use a little work, but by and large, we like the foundations and the partnerships that you have started to build. Secondly, we heard that we want you to think about the patient journey from start to stop with respect to end-stage renal disease, prevention and delay of progression of disease, all the way through transplant, dialysis, to palliative and conservative care. This plan requires us to look at how we can support improvements at a system level. Today in Ontario, there's about 10,500 people on dialysis, another 12,000 with serious end-stage renal disease in multidisciplinary clinic care. There are about 25% of people on dialysis who dialyze at home, and 75% in hospitals, in satellite centres in hospitals, and in malls, in clinics in malls such as Westmount in London.
When you have cancer, your life is never the same again. And all this gave me the drive and passion to become a member of the Patient and Family Advisory Council, and also to say yes to the invitation to be co-chair of the Executive Sponsor Group and the working groups for OCP4. I wanted to give back to the health community that took such good care of me when I needed it, and also to assist to improve the system for others.
Like Joanne, and I was relatively involved in the system, certainly at a patient level, but the concept of a master system-wide plan was not something that I had any idea existed. All this stuff happens to you and you assume it happens for a reason, but you don't really see all the work that goes on behind the scenes. So first of all, I'm very thankful for all the people that work in the policy areas and put together the system that we have.
For CCO, it will mean taking a hard look at what we have set out to accomplish by 2019 and committing to delivering on those goals. So as we draw to a close this morning, I want to thank you very much for your partnership and coming today to celebrate the launch of Ontario Cancer Plan 4 and Ontario Renal Plan 2. The goals of each of these plans are very ambitious, but together we will achieve them. It will require ongoing active involvement and collaborative efforts of all of us to make these plans a reality. And it won't be easy, but we can do this. We have the right partners in place, and I'm confident that working together, we will create the best health systems in the world here in Ontario.